All right, Bruce. Hi, I'm Jessica DeMassa. Nice to meet you with WTF Health.
Nice to meet you.
This is Bruce from Frame Health, right?
That's
okay,
right.
so the sexiest thing I saw on your website is that you guys have exclusive access to the largest database of psychographic something or other for use in healthcare. What does that mean, and what are you doing with all of this data?
Well, what that means is when you're looking at how do you treat a patient, you can look at it very simply and say, this person has these clinical conditions, but we know that their outcomes isn't just how sick they are, it's how sick they are and then how they behave.
Okay.
So what we're doing is we're taking the way they behave at scale, because it all came out of Johns Hopkins, it's the real deal, 300 validation studies.
Real deal out of Johns Hopkins.
It's the real deal.
Nothing fake out of there.
And so as a physician or a payer or a pharma company is saying, how's this person going to, how's it going to work out? They can say, this is how sick they are, but this is how it's going to turn out because they're going to follow their plan or they're not.
I love it. So you guys are looking at this like not only as a way to like reduce hospital readmissions, but also a way for hospital systems to impact like HCAHPS scores and things like that. So I'm curious to know like what types of psychographic behaviors are you looking at, and like how are you interlying that in with the EMR data that already exists there to provide this rich picture of what a patient really needs to avoid coming back to the hospital?
Sure. So the type of psychographic data that we're most interested in are the ones that really affect their health outcome.
Okay, like what?
Well, we don't go into a lot of the specific characteristics, but for instance, attention seeking. I'll give that as one particular thing. Attention seeking.
Attention
seeking. Somebody's really narcissistic. So if
I might just be sick to get some attention?
Yeah, if you say, if you take this medication, it's not just going to make you better, you're going to feel better, but people are going to notice. Okay, so for that particular person, that's meaningful. For somebody else, say, hey, this is going to help advance science. That's meaningful. So we're able to identify that and then cue either other messages that go out or to the care team itself and say, this is what you have to emphasize with this person. I just want to add one other thing. And the thing that's really fun about this is we can tell them how to treat a person before they go into the hospital. So the HCAHPS, are they going to say, we can tell them before they go in, this person is going to complain that the nurses never showed up. Okay, well, we know that before they go to the hospital.
They've met my mother.
There they are. But maybe they've met another friend who, never complains, right? And we say, this person, that's not an emphasis.
This person's a pushover. Give them the mean nurse.
Exactly. This person's going to say the room's dirty because we know that type of person.
Okay.
So if they know that ahead of time, makes a world of difference.
Can we lift up like the rock here and like talk about where these psychographic, like give me just, come on, like are these social determinants kinds of things that you're looking at, like zip codes and stuff, or like what are you looking at to understand some of those like behavioral things about somebody?
If you
Facebook? Is this Facebook data?
No, we give them a personality test. So this is done straight, we look them straight in the face. We say, look, when I went into healthcare, we have a doctor or nurse or someone who represents them say, when I went into healthcare, I thought I'd have a lot of time to get to know every one of my patients.
Yeah.
It is not how it's worked out.
Right.
But if you'll spend 7 to 9 minutes doing this, the next time you speak to me, or you call my office, or you go to the call center, they'll talk to you the way you want to be spoken to.
Okay.
And so people say, yeah, I want that.
Of course.
And so the completion rate on the surveys are tremendous.
Okay, so very good. So you're aggregating and collecting your own data on this as well then. Very cool. So explain to me then a little bit about Frame. Like give me the little pitch. I've got about 2 minutes left, so keep that in mind. I want to hear about the company. And then who is your customer? Like who are you selling this to? I think you're working with health plans and hospital systems.
Right. Well, to get the data, we had to go through a hospital. So we've been working with Kaiser Permanente, UCLA, and Cedars-Sinai primarily.
All those crazy people in Southern California.
Well, that's where we're from. We're LA-based.
I'm LA-based too.
But boy, do we love Boston. So in any case, what we're able to do is to show, yes, we could predict an HCAHPS score, and we can predict readmission gigantically better than if you just use the clinical data.
What's your margin of error? Like how close are you to predicting that stuff?
Well, it gets to this really mathy number called a cross-anthropometric logistic regression. It's like what Netflix does. What Netflix does to say this is the next movie, that you want to watch. So if you can get that to 0, you never make a mistake. That number's been stuck at 44 for quite a while.
Okay.
To statistical certainty, we're like 6 points better. And what we've actually been getting in work that we've done at Cedars-Sinai is 17 points better.
Okay.
So it makes a gigantic difference because how people behave when they leave the hospital really determines if they're coming back or not.
Okay, connect the last dot for me. So what's the value to the hospital then?
So we are moving our business out not that we won't service hospitals, but hospitals, we're in the business of keeping people out of the hospital. Fact is,
which is a great business to be in.
We still live in a fee-for-service world. 92% is fee-for-service. So we're starting to work with payers. We have to go to the guy who's holding risk.
Yeah.
So we can work with a Medicare Advantage provider, but just go to the payers. So we're really looking forward to, MassChallenge has been incredible in forging or in making introductions and now really initiating great relationships with Humana, with Cigna, and we'll be working with other payers.
I mean,
as well.
truly, this is a great opportunity to really transform the payment model around healthcare and reduce the risk and bring down the cost. I mean, it's fantastic.
Just to treat the whole person. Treat the whole person.
Very cool. Bruce, I'm getting the evil eye from Natalie behind your back, creepily over your shoulder. It's a pleasure to talk with you.
Well, I can tell you about her personality.
Oh, tell me. Is she one of those people who's going to complain at the hospital?
No,
it
I'll
looks
tell you
like
later.
it. Yeah, she really does. I mean, she's somebody who's like, this macaroni and cheese ain't hot enough. I can just see that in her.
Okay. Jessica, thank you so much.
Nice to meet you, Bruce. Thanks so much.